Sciatica nerve pain relief in seconds, doctor approved. What I'm about to share with you has been reviewed and approved by medical professionals, and I need you to take that seriously, because what you are about to hear is not what most people get told. Not in a clinic, not in a 7-minute appointment, not in a generic prescription handed to you on the way out the door. This is the information that gets left out, the part that would actually help you, the part that most people only find after months, sometimes years, of suffering through something that had a solution the entire time. Let me ask you something direct. How many times have you woken up and felt that burning before you even opened your eyes? How many times has that shooting electric pain fired down your leg without warning while you were sitting at your desk, standing in a queue, trying to sleep, trying to simply exist without your own body working against you? And how many times have you been told to rest, take this medication, come back in 2 weeks, and walked away feeling like the real answer was never actually given to you? That ends today, because in the next few minutes, I'm going to show you something doctors know, something backed by anatomy, by clinical research, and by the real mechanics of how your nervous system works that can interrupt your sciatica pain faster than you think is possible. Not mask it, not temporarily quiet it, interrupt it at the source. But I need to warn you about something first, something urgent, something that is making your sciatica significantly worse right now, today, without you even realizing it. Stay with me. This is the part that changes everything. Part 1, the alarming truth about what is happening right now. Here is what nobody tells you directly. Every hour you spend in the wrong position, every hour you rest incorrectly, sit incorrectly, sleep incorrectly, the compression on your sciatic nerve increases. Slowly, quietly, without pain announcing it in the moment. And compression, sustained, unrelieved compression on a major nerve, is not something the body simply bounces back from on its own. Let me explain what is actually happening inside your body right now. Your sciatic nerve is the largest nerve in the human body. It originates from 5 nerve roots in your lower spine, L3, L4, L5, S1, S2, merging into a single powerful nerve that travels through your pelvis, deep through your hip, down the entire length of your leg, branching into your foot and every toe. This nerve does not just carry pain signals. It carries every motor and sensory signal your brain sends to your lower body. Movement, sensation, reflexes, circulation. Everything below your waist depends on this one nerve pathway remaining free and unobstructed. Right now, somewhere along that pathway, something is pressing where it should not be pressing. And here is the alarming part. When a nerve is compressed, the body does not just experience pain. The nerve itself begins to change. Prolonged compression causes inflammation around the nerve sheath. That inflammation causes further swelling. That swelling causes further compression. The nerve becomes increasingly sensitized, meaning over time it takes less and less stimulation to produce more and more pain. This is why sciatica that starts as occasional discomfort can become, within months, a constant, debilitating, life-altering condition. This is why people who ignore early sciatica symptoms often find themselves in significantly worse pain 6 months later, wondering what happened. This is the urgency. This is why acting now, today, with the right targeted approach matters more than most people realize. And here is the specific source that most conventional treatment completely misses. Deep inside your hip sits a muscle called the piriformis, small, largely unknown outside of specialist circles, and in the vast majority of sciatica cases, the single most important muscle in your entire pain picture. The piriformis sits in direct anatomical contact with the sciatic nerve. In a significant percentage of the population, the nerve passes directly through the muscle tissue itself. When the piriformis is chronically tight, which it is in almost every person who sits for extended periods, who carries any history of lower back or hip strain, or who has not specifically targeted this muscle, it compresses the sciatic nerve with sustained, constant pressure. That pressure is generating your burning, your numbness, your shooting pain, your interrupted sleep, your inability to sit, stand, or move freely without bracing for impact. And the most alarming thing of all, standard treatment almost never addresses it. Pain medication does not release it. Rest tightens it further. Even many physiotherapy protocols skip directly past it, which is why so many people suffer for so long. Not because the solution does not exist, but because they were never pointed toward the right place. Today, you are being pointed there directly. Part 2, the doctor-approved method, exact steps. This is the part where you stop reading and start doing. If you are not already on a flat surface, get there now. Your floor, your bed, a firm sofa, anywhere you can lie safely on your back. Do not wait until later. Do not bookmark this for tomorrow. The nerve that is being compressed right now does not benefit from you watching passively. Do this with me right now. Step 1. Lie flat on your back. Both legs extended, arms relaxed at your sides. Take one full breath in through your nose. And on the exhale, release every muscle you are holding. Feel your lower back settle into the surface. Feel your jaw unclench. Feel your shoulders drop. Good. Step 2. Bend both knees, bring both feet flat to the surface beneath you, hip width apart. This position immediately reduces the load on your lower spine and gives your nerve roots the first moment of genuine decompression they may have had all day. Step 3. Create the figure 4. Take the leg on your painful side. Cross that ankle directly over your opposite knee. Allow the knee of your crossed leg to fall naturally outward. Do not push it down, simply let gravity do the work. You have now created a figure 4 shape with your legs. Hold that position for just a moment and notice what you feel in your hip. Even a subtle awareness, a mild tightness or pull, is your body confirming exactly where the problem has been living. Step 4. Initiate the release. Very slowly bring your opposite thigh toward your chest. Use both hands placed behind the thigh to draw it gently toward you. If reaching is uncomfortable, use a folded towel or belt looped behind the thigh. Hold both ends and pull toward you. The mechanics are identical. The moment you begin pulling, you will feel it, deep in the hip of your painful side. A profound, specific, reaching stretch unlike anything a standard back exercise produces. That is the piriformis. That is the exact muscle compressing your sciatic nerve, and it is being stretched directly for possibly the first time in months. Do not tense against it. Do not push through sharp pain. If the sensation is a deep aching stretch, stay with it. If it is a sharp stabbing pain, ease back slightly and hold at the point just before sharpness. Hold this position for 45 full seconds. Breathe slowly throughout. Inhale through the nose, exhale through the mouth. With every exhale, consciously release any tension you are holding in the hip, the thigh, the lower back. The piriformis releases in response to breath and surrender, not to force. At approximately the 20-second mark, you will feel a change. The muscle reaches its resistance point and begins to yield. The stretch deepens. The sensation shifts from effort to release. Stay with it through this point. This is where the real decompression happens. 45 seconds complete. Gently lower your foot. Step 5, the neurological reset. This step is clinically important and most people skip it entirely, which is why the relief lasts 2 hours instead of 2 days. Stay on your back, both feet flat, both knees bent. Place both hands on your lower abdomen just below your navel. Now breathe deliberately. Inhale through your nose for 4 counts. Feel your hands rise as your belly expands. Hold for 2 counts. Exhale through your mouth for 6 counts. Feel your hands fall as every muscle from your hips to your chest releases completely. Repeat this 5 times, slowly, without rushing a single breath. Here is why this is non-negotiable. When the sciatic nerve is under sustained compression, the central nervous system enters a continuous threat response. The surrounding musculature stays contracted, braced, guarded. Even after the physical compression source is released through the stretch, the nervous system keeps the muscles tight because it has not yet received the signal that the danger is over. This is the hidden mechanism behind temporary relief. The stretch releases the grip, but the nervous system immediately rebuilds it because nobody told it the emergency was finished. The slow diaphragmatic breathing directly activates the parasympathetic nervous system, the biological mechanism that turns off the threat response. It sends the signal at a neurological level that the muscles can release fully and permanently. Without this step, the piriformis retightens within the hour. With it, the release holds. 5 breaths, all the way through, every time. Step 6. Rise carefully, roll to one side. Use both hands to press yourself up slowly. Stand upright. Take one deliberate step forward, then another. Notice what is different. Part 3. Why this works and what happens if you ignore it. Let me be direct with you about something that most health content will not say out loud. Sciatica does not plateau on its own. It does not find a comfortable level and stay there. Left unaddressed, with the compression source intact and the daily habits that feed it unchanged, it progresses. The nerve becomes more sensitized. The pain becomes more frequent. The relief between episodes becomes shorter. And the window where simple, targeted intervention produces fast results quietly closes. That window is open right now. You just performed a clinically validated release technique targeting the exact muscle responsible for the majority of sciatica cases. You followed it with a neurological reset that gives the release its best chance of holding. That is not nothing. That is significant. And your body is responding to it right now, whether you can feel it yet or not. But here is what determines whether today becomes a turning point or just another temporary fix. The piriformis does not tighten in isolation. It tightens in direct response to how you position your body for the hours you are not actively treating it. And if those positions do not change, the tightening returns. The compression rebuilds. The pain comes back, and it brings slightly more of itself each time. So here are the 4 things that must change starting today. First, sitting position. Both feet flat on the floor. Weight distributed evenly across both hips. No crossed legs, no leaning to one side. If your chair does not support your lower back, place a rolled towel or small cushion at the curve of your lumbar spine. This single adjustment eliminates one of the primary daily drivers of piriformis tightness. Second, the morning stretch. Perform the figure 4 stretch every single morning before your feet touch the floor. Not occasionally, not when the pain gets bad, every morning, as a non-negotiable first act before you load your full body weight through a piriformis that has spent the night tightening. 2 minutes every morning. This is the single most powerful preventive action you can take. Third, sleep position. Tonight, place a pillow between your knees if you sleep on your side. Place a pillow beneath your knees if you sleep on your back. This eliminates the pelvic rotation and hip loading that compresses the piriformis and feeds sciatic nerve tension throughout the entire night. People who make this one change report measurable reductions in morning pain within the first week. Fourth, movement frequency. Stand up every 45 minutes. Walk briefly. Perform gentle hip circles. The sciatic nerve requires movement to maintain healthy function. Sustained stillness, regardless of position, is a form of compression. Movement is medicine for a nerve under pressure. Now, one final thing, and this is important. If you are experiencing progressive leg weakness, loss of bladder or bowel control, or pain that is rapidly worsening despite targeted treatment, please seek immediate medical attention. These are signs of a more serious nerve involvement that requires clinical assessment beyond what any exercise can address. But for the vast majority of people watching this, people dealing with the daily burning, the shooting pain, the interrupted sleep, the mornings that start with dread before they even start, you now have something real. Not a painkiller that quiets the alarm while the house burns. Not a generic stretch that touches the surface and calls it treatment. A targeted, doctor-approved, anatomically grounded method that addresses the actual source of your pain, directly, in the time it took to watch this video. Your sciatic nerve has been under pressure. You just relieved that pressure. Now keep it relieved. Every morning, every sitting position, every night before you sleep. Because the body that has been generating this pain is the exact same body fully capable of stopping it. It was waiting for you to give it the right information. Now you have it. Use it.